let's see if we can reconnect with Dr. Opoku-Ware Ampoma. Doc, thanks again. You were in the process of telling us what it's been like for you.
Yes, I said we've been trying to get ourselves ready to deal with any issues that would arise from this pandemic, as well as also trying to make sure that we don't take our eyes off the ball with respect to other patients that also have other critical life-threatening conditions. And as you're well aware, there have been issues about the health and safety of our frontline staff and the preparedness of the entire nation for the worst case scenario, etc., etc. So we've all been trying to put our minds and heads together, and we're grateful to the government and to corporate bodies and individuals for right now to the call to supply health workers with protective equipment and other supplies so that we can be on top of things.
Right. Now, let's talk about that, the provision of supplies. Now, this is important for all of you who are working in hospitals, not just those who are dealing with COVID-19 patients. Tell us about the reality of the numbers, the availability of PPE, and all the general supplies that are needed to take care of other conditions in addition to COVID-19.
Yes, I think initially, there were quite a few changes. What we should realize as a nation is that every hospital, whether public or private sector, that deals with patients, whether outpatient or inpatient, is a potential frontline because when a COVID patient is presented to a facility, there will be no bells and whistles announcing that. So every facility has to have a certain level of preparation so that in case a case shows up, they will have the preparation and materials that are necessary to deal with this problem. So initially, I think there were some challenges in terms of how widespread the situation was. But I think now everybody's going to get a message that every facility is important, and so we're seeing an improvement in the availability of PPEs, but there's still a lot more that needs to be.
Right. Now, we are always reminding everybody that these are not ordinary times, and that's certainly true for you and your colleagues. Tell us some of the practical ways in which you have had to adjust. What are some of the things that have changed in the way you do your job since COVID-19 became a reality?
Yeah, so one of the things that we've had to take this issue of social distancing practically. And so we've had to review our outpatient attendance and the numbers, because previously you find that you had a huge crowd of people sitting in the outpatient waiting to see the doctor. So now we've come up with an appointment system which schedules patients so that not more than 10 to 15 patients are scheduled to see the doctor within a 2-hour period. So they come in batches, so that we know all bunch up together, and then we try to see them as quickly as possible. We also encourage our patients to also wear their own safe, and then keep the health workers also safe. And the health workers are all wearing the requisite PPEs for whatever situation that they are dealing with. Of course, before you enter the facility, their staff will screen you. Before that, you'll be screened, and then you have to go through the hand washing and using hand sanitizer, etc., so that you do not come and contaminate the hospital environment. Unfortunately, we're still seeing a number of emergency cases. That is, people who are getting burned, people who are having road traffic accidents and other injuries, who are coming in as emergencies. And this is probably where we have a bit of an Achilles heel, because any of these patients could potentially be a COVID-19 patient. So how do we screen these patients readily? Because if you look at our test results, the turnaround time is still a bit too long. And so if you have a patient that requires urgent surgery, then how do we make sure that we avoid getting the team that will put on this patient protected, or how do we avoid getting the infection? So those are some of the challenges. So at the moment, what we are doing is that we assume every patient is a potential carrier and try and take appropriate precautions.
Right. Now, of course, the strain on our public health system is palpable, is visible. We had a weak system to begin with, but now, these numbers are threatening, the very integrity of our public health system. So the last thing we want is for us to have any increase in any other kinds of conditions that will further take away from our limited resources. For example, burns, which is your area of expertise. So what would your advice be to families during this time, during lockdown, to prevent burns?
In fact, there's a whole lot that can be said about burn prevention. And the truth is that as a country, we are not doing enough in terms of educating the public and then adopting behaviors that will make, burns, the burn numbers come down to the barest minimum. In fact, I was very sad when I heard this morning on your network that a mother and 2 children have been burned to death in Takrady because of stored petroleum in the bathroom that exploded, caught fire. So one, these flammable substances are not supposed to be stored in the regular containers. They are prescribed containers that are meant to store petroleum products. They are usually metal and they have quite the same class. But we find that most people store petroleum products or flammable substances in this, before gallon or other types of plastic containers. And even when you pass by them, you can smell it. Once you can smell that, there's an explosion. And so we all need to be careful. Petroleum products are not supposed to be stored in the house. You have to have maybe an outhouse or garage somewhere away from the sources of flame where you store such things. And they need to be in the prescribed containers. Now, coming back to the home situation, we need to be careful with the way we handle hot water. We are about to enter into the rainy season, and many people tend to prepare hot water to bath. You find that most times when we prepare the hot water, we want to carry the hot water with us, to the bathroom before we can drink it. But in the course of transport, somebody can stay, you can provide with some of a child and a can sit where you are preparing it. The same way, the kitchen, for instance, is not a playground for children. You find that many homes, there's no clear demarcation of the play area in the kitchen. So the kitchen is part of the playground space for the kids. So the kids are running around and then they run into hot soup, run into flames, etc., and they get burned. So we need to be careful about it. Electricity is also one of the causes of burns. We need to be careful with our electrical gadgets, make sure that we switch them off when we are supposed to, and we are doing appropriate maintenance on them. And then the way we handle chemicals and other hazards in the home is very, very important. You don't put flammable substances or acid and other chemicals into Coke bottles or Sprite bottles. So our children think that these are, soft things, and then they pick them up and drink them accidentally. So it is a question of being conscious of our environment and being prudent, making sure that their home environment is as safe as possible for ourselves and for those our loved ones who are in the house.
Right. I want to say a big thank you to you, Dr. Opoku Ware Ampoma of the Burns Unit of Kolebu, our frontline personality today. We thank you so much for the sacrifice you're making and for the hard work that you and your colleagues are putting into saving lives every single day.